before the main line was open. Okay, I'd like to welcome everyone and thank you for your patience. Welcome to Dappers East for the College of Complexes, meeting number 3,863. Please be mindful of our surroundings and take care of the wait staff. We're going to go through the rules and the agenda real quick. Two simple rules. No personal attacks and one fool at a time. That being said, we'll get the updates from Charlie and then we'll get into the rest of our agenda. Take it away, Charlie.
Okay, Charlie. Right, once again, welcome everyone to meeting number 3,863 of the College of Complexes, the playground for people who think. Now, although I am not a capitalist, I will give an advertisement for our upcoming programs. We're operating on a strict 2-week schedule every 2 weeks. Every 2 weeks we're scheduled an event. Well, the next program would be on July 4th. Unfortunately, the restaurant is closed, so there will be no program.
When?
Subsequent to that, the next scheduled program will be on July 18th, 1/8. July 18th, Professor Bob Lichtenberg will be talking about and answer the question of, am I free or am I constrained by external forces? So it'd be a question of a humanistic discussion on freedom and your situation in the cosmology. Okay, hope to see you then. Take it away.
Thank you, Charlie. And once again, I apologize for the delays of getting started today. Those that know Charlie Paydock, he's our noble leader, attending remotely. We've got Tim behind the computer running the show. And for those unaware, my name is Chris Laurent, and I'll be moderating this event. Okay, so tonight our discussion circles around national health insurance. And the topic is Medicare versus Medicaid versus ACA, or what's left of the movement for single payer, which is euphemistically called Medicare for all Americans. Without further ado, I'd like to welcome our guest speaker with his presentation. Please welcome Mr. Michael Burack.
Thank you. Thank you. I was waiting.
Then we apologize for the delays, Michael.
No problem. I have a bad knee, which is why I'm using the cane. Just a little background, 2 minutes. I've been in the healthcare industry in various capacities for 65 years. And I started at 18, so that makes me 83. And I was a Medicare user, but switched a few years ago to United Healthcare Medicare Advantage. Somebody was just telling me that I was making a mistake, but it's symptomatic and symbolic of the possibilities in healthcare today. The main thing that I wanted to talk about, and then I'll talk about single payer, is the system, hospitals, doctors, clinics. The system is being controlled by money. Private equity is now buying hospital systems. There's one here on the North Shore that used to be called Evanston Hospital, and then it was something else, and now it's something else. It's 4 hospitals, Skokie Valley, and 2 others. They are owned by a private equity firm. And if you know what private equity is, it squeezes and squeezes until it makes money. It doesn't matter what the industry is. Private equity is dangerous. It's controlling the country in many sectors and getting more support all the time from Washington. And I think that's one of the things we need not only to be aware of, but maybe do something about. I doubt that anything like that is going to happen in the next couple of years. Washington seems inclined to go with the money for now. It always has been a money town, but now it's worse than ever.
Right.
The healthcare system generates about $6 trillion, and that's why private equity was attracted to it. Charlie wanted to know about the AMA, which is, of course, the Association of Physicians in the country. And what I'm going to do is I passed out a poorly done, but the best I could do diagram with what's called single payer in the middle. Single payer means basically that everybody belongs to the same pool, is in the same pool, and there are various other entities which I'll go through. The AMA, interestingly, opposed Medicare vociferously, but they obviously lost, and Medicare has been around for quite a while. Some people are happy with it. Some people are not. I, for one, was not happy with being just in Medicare and buying a supplement and a drug card, which is why I said earlier I switched from straight on Medicare to a United Healthcare Advantage plan, which is not perfect. But doctors have generally opposed what's called single payer. Single payer basically means that all of us, for example, everybody in this room, it's a pretty old crowd. Well, no, there's one young guy, the host, Chris, is in the Medicare pool. Well, maybe there's a couple of others. I don't know. They're smiling. So
I'll be eligible in about a year.
Tim says he'll be eligible in a year.
Right now I'm in the VA, so.
But this is a Medicare crowd, and that's not bad. It's just the way it's worked out. I think that Medicare is a single payer. The question then is, do we want the whole country to be in a Medicare-like program so that everybody pays a little and the whole country gets its health care paid for by a single fund? I don't think that's what we want. And single payer in its various forms is symptomatic, but also different than Medicare, and has pros and cons. And if you look at the diagram I apologize for the artwork. If you look at the diagram, you'll see at the top on the left side, my left and right, there's a pro and con.
Yeah.
Okay, under pro, there's an organization actually domiciled here in Chicago called the Physicians for a National Health Plan. They're, I think, on Madison and Clark. So I looked them up to see what they were all about because they are pushing a single payer plan. When I found out what the membership was, there's 1 million doctors in the country. Okay. And the AMA has kept that number pretty constant for the last 60 years, which is why now, as our population has aged, it's gotten more difficult to get in to see a doctor because there's too many people who need the doctor and there's too few doctors. So this organization, Physicians for a National Health Plan, up in the upper left-hand side, is pushing doctors in their group for single payer. So remember, I said there's 1 million doctors in the country. This organization has 20,000 members, which tells you that doctors are not running to get into an organization that's pushing single payer. If you go down the list, I'm not going to go through all of them. There are unions that are single payer oriented. I had a very good friend who was a Teamsters organizer, and the Teamsters have a fabulous program for themselves. It's single payer. The members pay into a fund, a trust fund, and the trust fund pays their bills. Teamsters generally do pretty well. They make a lot of money. Could you Excuse me, sir,
I'm gonna see if I
could you close that blind, please? Sorry, I can't see. Thank you. So the Teamsters Fund, it was terrific for Teamsters. It still is. And yet, very few unions are on the cusp of supporting a single payer plan for the entire country. Academics, I have a collection of books, some by academics and some by feature story writers. In your packet, there's a list of books about single payer insurance. Some of it is about other countries. And I have one here, and I think it's on the list. It's called Lives at Risk.
Yep.
It's a very good book. It really discusses the issues around single payer, the pluses, the minuses. I recommend it highly. All of the books on that list that you have that I typed, which is the only part of the presentation I typed, they're all older. And why is that? Well, there are so many other things going on right now. The country, our country, is really not paying attention to the healthcare situation. I'm not going to say any more about politics. I'm not going to say any more about direction. But we all know that healthcare, while it's a big issue and a big problem for a lot of people, is not being paid attention to. I don't see any big changes coming in healthcare reform in the next 2 years, 4 years, 6 years. Okay, so let's go down the list. Nurses. The nurses, interestingly, who are traditionally non-financial people, are probably the most active groups around. There are several nurses organizations in the upper Northwest, Washington and Oregon, and I talk to them occasionally. They send me invitations to events they're having, promoting what's called single payer. They have a fairly good sized membership, but they don't have any clout. Nurses that just don't have the kind of clout that, for example, a physician's group pushing for whatever would have, because they're just low on the totem pole, but they're basically running the hospitals, as we know. Going down the list, I'm not going to go through all of them. I talked about doctors. Congress. I see that Charlie has a Bernie Sanders poster in back of him. And Bernie Sanders and that young woman congressperson from New York have been running around the country. I'm sorry?
AOC.
Yeah, AOC. I can never remember her name. I'm not crazy about her. That's why. Anyway, they are single payer people. Bernie was the first person to introduce a single payer bill in Congress. And of course, Bernie, and his followers went nowhere with it. And I don't see any evidence that Bernie and his position will surface. I'm always willing to admit that this is a free country. Without making it too political, I don't know, and nobody knows what's going to happen in the next election. The country is in turmoil in many areas. It's possible that things will get so bad for so many people that there will be not a revolution, but there will be major changes made in the next presidential election. That's a personal comment, but I believe that sometimes there is a reaction to what I consider to be bad behavior. The average American is doing much worse. And if the average American can get organized, it's possible that things will change. Congress will change, the presidency will change, and go left. I don't know. It's a possibility. If you go over to the right side, these are some of the organizations that are against single payer. Okay, I talked about the AMA, and doctors, lobbyists. There are tons of lobbyists in Washington who are making millions of dollars assuring their markets that single payer, in other words, national Medicare, will never happen. The pharmaceutical industry doesn't want it because they're making a bundle on what's currently being done. People get their drugs paid for, not always all of it, but they're getting paid. There are lobbyists who are devoted entirely to the single payer option, and there are lobbyists entirely devoted to anti-single payer. There are other unions who are against single payer. Some unions, I don't know their names, I can't cite them off. But the point is that there's a lot of turmoil and a lot of questions about whether single payer is the answer. Yes.
Yes, would you clarify what you mean by single payer?
Yeah, everybody in the country would be in Medicare.
And then how do they pay for it? I mean,
Well,
we
people would pay
we
for it and the
Medicare.
government would pick up the tab as well. There would be a
tax
formula,
over here,
a
Medicare.
tax. Right.
Now,
Yeah,
Medicare is a single payer
it is.
for seniors.
For senior citizens, Medicare is a single payer.
I see, so.
You have to be over 65.
Over 65.
So that makes it single, okay? And it's your taxes are paying for it. Okay.
Are withholding all those years.
Right, for all those years. That's correct. Lots of years. Okay. The question that's always raised in my thinking is, where are we going? And to be perfectly honest with you, I haven't got a definitive answer to that. I think we need to sort of play it out. If you want to participate in a single payer program, there are lots of ways to do that. And I put my email at the bottom of this first piece of artwork, and I use that term loosely. I don't draw very well. My drawing is kindergarten type. And the issue, of course, is that it's America, and everybody's opinion counts for something. And there are a lot of different opinions about single payer. Whether the country can afford single payer or not is a whole other question. And my opinion, having studied this business for 65 years, is no, the country really can't afford it. We owe $50 trillion to the rest of the world. Our bonds are being bought still, and we owe $50 trillion to other countries in the world who have bought our bonds. If the United States somehow falls out of favor with the rest of the world, I don't know, things happen.
Yes.
And people want their money. They want to cash in their bonds because they don't believe in the financial stability of the United States. Where will that leave us? Bankrupt. And the same thing can happen in single payer. So the question is, and I'm running towards the end here, is there a solution to the whole issue of non-single payer? Since you've obviously gathered, I don't believe that single payer is the answer. Well, I've developed a formula that goes state by state. It's in your packet. There's a drawing. There's a couple of boxes. The box at the bottom says everybody in a state will pay into a fund. That's what that means. The question is,
No, you need.
what will the state be able to pay as a maximum? There are maximums that Medicare will pay. There are maximums that insurance companies will pay. And the answer is, we don't know.
No, so you keep.
So my solution to the issue that I just raised is all 50 states should have a could have a single payer program. Now, one of the entities that I haven't mentioned, talked much about it, is the insurance industry. The insurance industry is cleaning up on everybody. They make more money now than they've ever made. They pay less in claims than they've ever done. So how, though, would they react to a single payer, a national single payer? They'd be against it. They like it just the way it is. They collect the premiums and they never give back what they're supposed to give back. So what I'm suggesting, if you look at that diagram, is a law that says every state should have a single payer program for its residents. Now, in the commercial markets, that businesses use all day, every day, there's a policy called specific and aggregate. And what that does is a corporation decides to self-insure itself up to a certain point, like single payer. Okay, I don't know what the number would be. Maximum on the right-hand side, you'll see it says maximum for single payer. I don't know what that would be. But in order to keep the insurance industry at bay, I'm suggesting that there is a policy, as I said, called specific and aggregate payment. And what that means is exactly what it says. For specific claims, they'll pay up to a certain amount. And in an aggregate amount, they'll pay up to a certain amount. Insurance companies like that. They like definition. We used to do business when I had my business with self-insured companies, and they didn't want to take on all the risk. They could have $1 million claim and be responsible for the whole thing. But there's a specific insurance policy, as I said, called specific and aggregate, that would be for each claim, a specific amount, for example, on an annual basis, and an aggregate amount on an annual basis. My theory is that that would keep the insurance companies happy. I don't know. I don't talk to insurance companies anymore, but I'm throwing them a bone by suggesting that if the United States decides to go single payer, that the insurance industry can play a role in that, even though they're taken out of the big part, by providing a specific and aggregate insurance policy for everybody. Okay, so that is all largely opinion, but it's based on a lot of experience. I gave you all a bibliography. I said that this book, Lives at Risk, is a terrific book. My suggestion is that you keep your eyes and ears open. This situation could burst into the open as the trust funds for Medicare go broke, which they may well. But as I said just a minute ago, there are insurance policies called specific and aggregate that I think would help. And it would get the insurance industry off of the public's back. I don't know what else I can say. I've looked at other countries. Everybody talks about the Canadian health system. Somebody here was talking about it earlier. Yeah. Everybody says, oh, the Canadian system. Yeah. It's not that clean. There are people who are unhappy with the Canadian system. We just don't pay attention to them. If I had to pick a self-pay country that people don't have any problems with, does anybody know? It's a European country.
Switzerland.
Where?
Switzerland.
It's okay. Switzerland's okay. It's not the best.
Norway's
Okay. The best single payer insurance program in Europe is France. If you get sick in France, you go to the doctor, zero. Well, why is that? Well, France is a very rich country. Geographically, it's not a big country, but when they had the colonies, they raided the colonies and brought all that gold and other stuff. France is rich. You just saw Trump in France. They're very, very comfortable. I have family in France, 26 cousins. They don't worry about healthcare. If they have to go to the doctor, they go to the doctor. Chris, my partner, is here. She and I have talked about this, and I know somebody who moved to France not long ago, who Chris knows, got COVID, went to the doctor, an American, a husband, a wife, and what did they have? One kid?
2 children.
2 children.
Yeah.
She got COVID just recently, last year. An American who became a resident of France, got COVID, went to the doctor, whatever. What was her fee? 0. And she's a latecomer to the system. So France is taking care of its citizens, unlike the United States, which is putting citizens behind the 8 ball by not putting limits on costs that insurance companies are not paying. Hospitals. Years ago, when a hospital wanted to build a building, they had to go get a certificate of need from the state authority. That's all gone. Hospitals are running wild. They're collecting billions and billions of dollars. And I use Northwestern for whatever I need. I always get a bill. And I call them up and I say, take what you can get. Sue me. And they never do. They're not like that at that place. But that's not typical. There are hospitals that go after patient balances. Single payer might change that, but I'm not sure. I don't believe in single payer for the whole population because of the reasons I gave, unless it can be done the way I just described. Basic benefits and a policy by a commercial insurer on top so that there's no leftover. Hospitals have billions and billions of dollars of unpaid claims, whether it's Medicaid, Medicare, commercial insurance, and they're still doing very well. Okay, so that's pretty much what I had to say. Obviously, I'm biased, and I see Chris is coming up. I don't have much else to say. If you have a question, fire away. Yes.
Turn your mic on.
All right.
Well, actually, Tim, before we get into that, I want to thank Mr. Burack. Michael. I want to thank Michael for the presentation. We're going to move into the Q&A portion, so please stay here.
Okay,
Looks like Tim's got the first question.
what's the question?
Why is it that we can spend billions of dollars replenishing our bombs, keeping our military ready to kill people, but we can't find the money for healthcare?
Ask your congressman. I don't have the answer to that.
Yeah, Congress gets.
It's a political issue. There's no answer, Tim. No simple answer. Okay. And as the population of this country has aged, the situation is only getting worse. Yeah.
I got a 2-part question. The ladies over here started the question. How are we compared to? I always like to compare American population to Western Europe because it's similar. It's around 300 million in both places. I'd like to know how many doctors, specialist doctors, and general doctors there are in Western Europe. And the second part is explain your insurance plan to us and why you
I
like
have
it.
no answer for the first question. I don't know the answer to that.
Because it's a supply and demand thing,
Yeah,
because they don't allow the more doctors, the cheaper.
I don't know who regulates doctor entry in Europe.
No, here, AMA.
The AMA and the AMA.
They don't want a lot of.
Listen, there's 1 million doctors in this
And there
country.
should be 2.
There should probably be twice or 3 times that. But the AMA has restricted the building of new medical schools.
Yeah.
It's been 1 million doctors for the last 80 years. And look at how the population is growing. So that's the problem. And I can't give you an answer on the second question.
So, okay, explain why, who are you with, United Health? Who's your,
United Health Advantage, Medicare
now,
Advantage.
why specifically do you like them?
They give you a lot of little benefits like pharmaceuticals. I pay 0 for my pharmaceuticals.
Okay.
I didn't like having paid Medicare, having a Medicare supplement and a drug supplement. Everything is all in one package.
Okay,
That's it. That's
okay,
why-
we're gonna move on and you can get
That's
another
why you
question.
like it.
We're gonna move on
They
and you can
pay,
get another
I
question
pay zero for
after we work
drugs.
the room.
I don't pay for drugs.
Hi, talking about costs. There have been a lot of stories about fraud in Medicare and also fraud from people like United Healthcare, where they would send nurses out to visit people
Right.
and run up what they're charging, even though the person it would be like.
Yep.
So you want how much is fraud a plus of Medicare?
I don't know.
Is it that large a number?
You know, I don't know.
There was a story in Florida. For
Yeah.
me, it doesn't seem to be trivial. You may say, I don't know, and that's easy, and I can understand easy. But to me, it doesn't seem to be trivial because there was a story from California where they had a lot of healthcare in one building that had like 5 offices in it.
Right.
So you could say, oh, I don't know, and I could live with that. But it doesn't seem to be trivial. I would think.
I didn't think it was trivial. I just said I don't.
I think the speaker would be prepared.
Okay,
I beg
Sam,
your pardon?
I think the speaker would be prepared.
I'm very prepared. What do you want to argue about? Something tangible?
Yes.
What do you want me to know about
How
California?
big is the fraud?
How do I know? Do you know fraud from real? You're telling me something you read in a book or a paper or a newspaper?
Things out of California, things that United Health.
Look, I don't want to argue. I don't want to argue about it.
Minneapolis, Minnesota. That's the question. Had the same thing.
I'm not arguing with you anymore. I'm done.
okay, we got 2
All right,
online now.
we got one more here in the room and then we'll go online. We got
Okay.
Russell back here, then we'll get the online, then we'll get Ernie.
Okay.
Okay,
Your single payer or Medicare for all, how does that differ from the National Health Service of Britain?
In theory, it doesn't. But I had an office in London. And what I can tell you is that anybody who has any means who lives in London does not belong to the National Health Service.
Well, I know many in Europe, especially the upper or.
Right.
big
People who make
corporations,
money. Right.
Have their private health.
That's right.
through the
Doctors.
corporations.
Right. They have private doctors. They have private hospitals.
we'll get Ernie after.
Everything in Great Britain, everything in Great Britain is not owned by the government. Okay? There are private hospitals, private doctor clinics, and anybody who's got any money gets out of the National Health Service and goes private.
Because it's better for private.
Okay, looks like we've got 2 people online. We're gonna start with Sam.
Can I sit down?
No,
I have to sit down.
Oh, okay. I
Yeah,
get
we
you.
can let him sit down.
Yeah.
Grab a chair up there and we'll put the camera on him.
There's a chair right there.
And
You
Go
got
ahead.
a camera that goes this far?
Yeah,
below?
yeah, we
Okay,
got.
sorry, I just,
all right, Sam, we'll let you go ahead and ask your question while he gets arranged in his seat.
Okay, Sam.
Yeah, okay, so my question is this, the speaker, does the speaker know how much it costs to administer Medicare as opposed to administering by private insurance? My understanding is that, for instance, the Medicare Advantage plan, which the speaker is partaking in, is it's funded heavily by the government. So either way, it's the taxpayers who are paying. But I want to know, what is the difference in cost of administration? My understanding is that it's cheaper to administer the Medicare plans. It's like 2% or something compared to private insurance, which they spend like 10 or 15% paying for administrating plans. And so, of course, that cost comes to us or whoever's ever paying for the plan. So do you know what is the difference in cost of?
no,
different-
I don't know the specifics. Here's what I pay now. 0.
No, I'm not asking what you pay specifically.
Yeah, I
You may
understand.
not pay
but Let me
0.
finish. Let me
I
finish.
pay you. I'm paying for you to pay 0.
Look, I had Medicare. I had to buy a Medicare supplement and a drug card and a dental card. Okay, in addition to what the government took for the payment for Medicare. Now I eliminated those supplemental coverages. I don't pay for them. I get dental. I'm going to the dentist this week. United Healthcare is picking up the tab. I picked up a special prescription this week.
Yeah.
Prescription.
Yeah.
All I'm telling you is my out of pocket with the supplement. I don't know, let's go good.
Yeah. I was briefly on an Advantage plan. I'm familiar with it. They give you these little trinkets, little useless things
Yeah,
like
well, some of it is useless, but my out of pocket is hundreds of dollars less on the Medicare Advantage.
How much you pay
and who is paying that? I mean, somebody is paying that. You
United
personally
Healthcare.
know.
United Healthcare is billing
government?
whatever.
Yeah, but my point is everything costs money. Somebody is paying for it. It's not free. It's free to you, but it's taxpayers. We're all paying for it. You're paying for it if you're paying taxes.
Okay, I have nothing else to say.
Right.
All right.
Let's go on to Charlie.
Yearly for United Healthcare.
All right, Charlie, go ahead.
Yes, Michael, you stated that France could afford good single payer health care, provide good health care. But isn't it possible that a poor country like Cuba, aren't they doing and providing relatively good health care for their people under the concept of socialism?
You want a one-word answer?
Yeah.
No. People in Cuba are starving. They don't get good health care. That was a pipe dream of the Castro brothers and the communists who are so-called communists who are running the country. I have a friend. I've been in Cuba twice. I have a friend who was just there. You can't see a doctor. They don't have paralegals, paraprofessionals like we have here, nurse practitioners who have taken up a lot of the responsibilities that doctors can't fulfill. You know, it's very rare, at least at Northwestern and others, I'm told, to see a doctor first shot. You get sick and you haven't seen anybody for it. The odds of seeing a doctor right off the bat are very unlikely.
Right.
However, there are clinics all over the city, Oak Street Health and others like that. You can walk in there and see a doctor, but if you have to go to a hospital, it's a whole other issue because you have to be admitted by somebody on staff. I can't, it's obvious that in this crowd and in the world, there is a lot of controversy about what I said and what's going on. It's not a simple solution. Single payer is not something that this country is heading towards. That I can assure you. Unless, as I said, there's a revolution in the government policy towards healthcare in the next presidential election or the one after that. It's very simple. It's about politics and money. I can't give it any more clarity than that.
Okay, thank you for that. We got Ernie coming up next.
Yeah, actually, we're gonna try and squeeze in a couple. I apologize, I was late. Promo, can everybody hear me?
Yeah.
Yes.
Promo said that you were gonna give summaries of several other countries, and if I missed that, then I'll shut up. But if not, I'm hesitant to do that.
I'm sorry, a summary of what?
Of other countries?
Of other countries, that's what the promo said.
What countries do you want to know about? I mean, I'm not intimate with other than what
Well,
I
I'm just
discussed.
saying that the promo said you were gonna give some kind of a summary. If that's not the case, we can just skip that for now. I guess my main question is, we as a nation, somewhere between 17 and
I'm sorry, I can't hear you.
Louder.
17 to 20% of our GDP on health. I think Britain is next with around 12%. And then other countries are 8, 5, much lower. What is the main reason for that as you see it?
I don't have an answer to that question, if that's a question.
Yeah,
Sorry.
that's the question.
All right, Tim, I'm sorry.
I got a question for you.
Okay.
The microphone's right there.
Okay, we all have.
Microphone.
Here's the mic, Mike.
There.
Yeah.
Mike.
Hi, can you hear me now?
Yes.
Okay, so we've all been paying all our lives for Medicare. You're on United Healthcare now, right? United, you said,
Yeah, United Healthcare Advantage.
okay, you're not on that for free, what's you paying a month?
No, they take what I was paying for Medicare.
Okay, they take the same fee.
Okay, so they're
I was
making a
paying for
couple
Medicare,
grand.
but I get a lot of other benefits because they're more successful in managing their money and screwing people. Okay, it's obvious how they do it, but I benefit by not spending hundreds of dollars on supplemental coverage that basic Medicare does not cover, like dental, okay, and pharmacy. Medicare is terrible, as I saw it on those two things. United Healthcare is great. Okay, now I've been lucky. I haven't been hospitalized under United Healthcare, knock on wood or Formica or whatever's convenient. But we'll see. I'm not saying that it's perfect, but out of pocket, I have saved several $100s a month for several years.
But you have to see specific doctors that are in the plan.
No, I go wherever I want.
Actually, if you could ask that question again.
When you're on a Medicare Advantage plan, I thought you had to pay.
There are,
Stay with certain doctors.
there definitely are some doctors and some hospitals that they don't recognize.
Mm.
Okay,
Okay.
I can't argue that point. You're right.
This one question.
Healthcare is quite an issue.
Mhm.
When you say,
It's an economic.
you talk about single payer,
One full at a
that
time.
would be everyone in the country would be on single payer? And
Well, if the country decides to eliminate Medicare and put everybody in a single payer program like Medicare, yes.
Mhm.
That's not necessarily what I believe in. I think it should be, as I said earlier, state by state. States should have the right to do what they want to do. There are two states in the country, Nevada and Connecticut, who have programs where this state is paying the healthcare for it's not all of its citizens, but in Connecticut, I think the state pays for 600,000 citizens of the state. Okay. And I pointed out the danger in not having an insurance policy on the top, because the bill, $100,000 for a major illness is not a lot of money by today's standards. So, but what I'm saying is that Nevada has a program and Connecticut has a program that pays for citizens of the state. Okay, there is no blanket answer. There is no blanket solution to the problem or the issues. Single payer can work. I don't think it's coming. And I don't know if or when it will come. Do I like single payer? In theory, I do, as long as there's protection so that the fund doesn't go bankrupt. That's why I said putting a commercial insurance policy on top of a single payer program is the way, I would do it, because it would give the insurance companies a bone. They're not going to just lie down and let single payer happen. Okay, you can bet on that. They make too much money. They're not going to just suddenly let the government finance with taxes everybody's health care. It's not going to happen in this country. They're the largest financial institutions in the country.
It's just that I have talked to.
I'm sorry?
I have talked to a few people, like this one lady in my building, she was from England. And so I said, oh, I hear that you have health insurance for everyone there. And she said, oh, yeah. And she said, no, we have the greatest system here. She said her mother had a broken hip and she had to have it repaired. They put her on a list for a year. It would take her a year.
Here or there?
There in England.
Yeah, that's what I was saying. That's why a lot of people in England have bought private insurance policies.
Right.
And go to private hospitals and private doctors. Okay,
Then
it's not a panacea what the British did.
Mhm.
Nothing the British do, as far as I'm concerned, is a panacea. That's a political statement. I'm sorry.
Well, then, a friend of my brother's, he married a lady from Colombia, and they were in Colombia when she had a heart attack.
Uh-huh.
And so they had to go to the hospital for the heart. And so they said they couldn't operate on her heart right away. And so he talked to the doctors and they said that she needed it right away. So then other people told him they're looking for a handout. he says, cross their palms with about $5,000. And then she can be taken right away, which he had to do.
Right.
So I don't
I'm
know.
not
when you say
surprised.
a
I'm not
single payer,
surprised.
You mean that everyone in the country, anyone that even comes in the country would be covered? They get a card that they would be covered by health insurance?
Well, they have to pay for it, but yes,
Oh, so then you're saying that individuals would have to pay for it?
yes, of course.
Mhm.
Yeah, but everybody would have the same benefits.
And to be a citizen of the country in order to have it?
You know, in most countries, people are citizens who use the healthcare system. It's not that easy to become a citizen. And in France, Christos, people become citizens.
They're trying to become citizens.
Yeah, they're not citizens, but they took her into the hospital with COVID. And she's fine. I think that there.
How big is France compared to the United States? We have
Oh, it's,
3,000 miles.
we're a lot bigger.
From coast to coast, we have 3,000 miles, and we have 50 states and some what, 5 or 7 territories?
Look, I'm not arguing the
I mean,
population
it's like
issue.
comparing,
Yeah. Yeah, apples and oranges, okay?
yeah,
Yeah,
okay.
the issue is the same, but I don't know. All I know is it's a great story. These Americans went to France, moved there, are going to become citizens. She gets really sick, 0. And Germany is the same thing as well. There was a friend of mine whose wife went to the hospital and had a procedure. She was in the hospital 3 days. She left, got in a taxi, went home, and wrote a letter to the editor in the Wall Street Journal and said, you know what I had to pay for my health care? 0. So smaller countries can do those things. I don't think America is the healthiest country on the planet. I don't know that single payer is the total answer. I was more concerned in what I was discussing that if we do a single payer, state by state, or we let states do it, that there's a cap on what the state is responsible for, and that an insurance company sits on top of the single payer program to pick up the excess charges. I'm throwing a bone to the insurance industry. I don't care for the insurance industry. Everything I ever did in my life professionally was anti-insurance. We ran self-insurance programs for large entities. No insurance involved. But what I'm saying is that they're not going to go hide in the corner if the country decides to do a single payer program for everybody. That's all I'm saying.
Okay, which country do you believe has the best healthcare plan and what makes it the best?
Well, I would say the 2 countries I just mentioned, France and
and
Germany. They're more left oriented, those countries, and they had a chance to rebuild their systems after the Second World War because they were totally destroyed.
I got a little bit.
We in this country have been, toddling along, tinkering, changing, doing. But Europe had to rebuild itself entirely. And one of the things that a lot of the European countries did, somebody the other over here said Switzerland, Germany, France, they redid everything so it's more beneficial to the population.
I support that because when my third cousin Gisela's mother was sick, they had in-home health care for her as a part of in Germany.
Yeah, in Germany, right.
They had in-home health care for
Yeah.
her without any additional cost for the remaining several months of her life.
But Germany is a much smaller country and much less fragmented than the United States. There's a lot of people in this country who think the only thing that's important is the profit motive.
Yeah, well.
And insurance companies are right at the front of the pack. Okay.
All right, we got 2 more online. We'll go with Charlie and then Jake after Charlie.
All right, Charlie, go ahead.
Yes, Michael, I don't fully understand it, but you see in the news that certain states, like red states, do not participate in Medicare or Medicaid. What is that? How does that change for the people living in those states? And the second question is, are there any initiatives in Illinois to bring us to have the best single payer plan of all is anybody spearheading any legislation?
I'll take the second question first, Charlie. As I said, the physicians for a national health plan who have 20,000 doctors are down on Madison. I would suggest, you call them and ask them if they'd come out and talk about what they want to do. But remember, as I said, there's 1 million doctors in the country. They only have 20,000 members. In the first question, every state is required by law to provide Medicaid. Okay. The states are, Medicare is a federal program and does not require states. It's a federal program. Medicaid is a state program. And there are states that do not do very well with Medicaid because they don't have any money and they don't have a population. So what I'm saying is that it's an option for Medicaid and an option for Medicare by the federal government. But everybody offers, the government, Social Security is connected to Medicare. So once you start collecting Medicaid, Social Security, Medicare is an option, number one, okay? And Medicaid is state supported, state funded with a little from the government and generally inadequate by today's standards.
Yeah, because it's politicized.
All right,
Mike, please.
all right, thank you for that. We're gonna go with, Jake online. Jake, go ahead and answer your
Jake,
question.
Go ahead. Jake, unmute, you're up.
Mic on?
The guy didn't like that.
Jake, unmute, you're on.
Hi, can you hear me?
Yes.
We can hear you.
Hi. Okay. Thank you for your talk. I got two questions. Number one, I was told that under the Canadian system, you're not allowed, if you think the doctor has done something wrong, you're not allowed to sue the doctor. And that way the doctors don't have to invest in malpractice insurance, and it keeps their expenses. It brings their expenses down. It's very expensive to run a medical practice. Is that true? Is that correct? And secondly, my second question is, how does the single payer system deal with the issue of liability? In total. For instance, if somebody falls and breaks a bone, falls out of a wheelchair, or falls over a crack in the sidewalk, or slips on ice or something like that, how do they deal with the issue of liability?
Well, the first question about Canada, I honestly think that, first of all, the doctors are not employed by the government. The hospitals are owned by the government, but the doctors are private practitioners. And, I have cousins in Canada, but I've never really discussed it with them. I really don't have an answer to whether you can sue your doctor in Canada. All I know is that what I'm reading of late in the last 2-4 years is that the Canadian system, in spite of its mix of public and private, people are not as thrilled with it as they used to be. And that's fairly typical in the world, except in the countries I mentioned in Europe. The second question, I don't have an answer.
Why aren't they thrilled with it?
Well, for the same reasons that people are not thrilled here. There's long waiting lines. Okay. If people don't have out-of-pocket expenses to look forward to or expect, they stand in line. There's lines in Canada, even though the hospitals are privately owned. The bills, obviously, for hospital stays are, much larger than for a doctor visit. So people can get to see the doctor and maybe even pay for it, part of it themselves. But getting into a hospital in Canada is not as easy as it used to be. And that all revolves around the fact that human beings are living longer. I'm 83. My parents were dead, long dead, before 83. And if you look around this room, people are older. And that's why the healthcare issue has surfaced and is bubbling up as intensely as it is. I want to know that I can be taken care of. I'm not as much concerned about the hospital for myself. I'm more concerned about being disabled and being alive and being home and needing care at home. the home health industry is a big problem in this country. Now, I'm looking for somebody, an agency that will take care of me if I get disabled and I can't walk around. I've got a bad knee, which is why I'm walking with a cane, but that will get fixed. I found a great place that fixes knees with no surgery.
All right, we've got Sam
Sorry,
online.
I'm not
What
promoting.
was the second?
It's called
What's
a
the,
joint
so you,
organization.
what about the issue of liability in general?
All right.
The issue of what?
Liability.
Liability in general in Canada.
In general?
Yeah.
What
If
do you mean
somebody
in general?
falls
In
and
the
breaks it,
population in
somebody falls
America?
In Canada.
In Canada?
Canada.
I don't know.
under the single payer system. Okay.
I
All right.
honestly don't know. I've never really looked at that. I'm sure I can provide an answer. Send me an email and I'll look it up and send you an answer. My email is at the bottom of one of the sheets. It's Michael.
I don't, I'm on the phone, so I can't see it.
We'll get it in the chat for
I'm
you.
more than happy to answer any questions.
I don't
you
have a
may.
chat. I'm on the phone.
All right,
Well, take it down. I'm going to give it to you. Michael BU at AOL.com. Michael BU.
Oh, Michael EU.
B like
Michael
boy
EU.
at AOL.com. Send me your question
Wait a
and I'll
minute.
get you an answer as soon as I can.
Okay.
Then boy, you.
Yeah, he is a boy, like me, a boy.
Thank you.
Thank you, Michael.
All right.
All right, we got Sam online.
Sam, you're up. On mute, please.
All right. Yeah, I certainly agree with the speaker that the insurance industry is hugely profitable and is probably the most expensive thing here. And, I think we should work on reducing the cost of the middleman, the insurance. So my question is a little bit, it's just rhetorical actually, is like, why should we be throwing the insurance companies a bone?
Yeah.
Let's get rid of them.
I don't think that the lawyers lobby is going to allow that. Okay.
Who cares?
Who are most people in Congress? What are they in Congress? They're lawyers. And in order to get rid of the malpractice stuff, you'd have to have a federal law, and I don't think it's going to happen.
Mhm.
The lawyers are on television all the time. You see them more and more and more because there's more competition. Because the law schools, interestingly, as contrasted with the medical schools, have expanded by triple in the last 50 years. So there are so many lawyers, there's too many lawyers and too few doctors. I've said it enough. I'm not going to say it again.
Okay, thank you for that. We got Mike here in the room.
Okay, just real quick, we
Okay,
have a
Mike.
one-payer system right now with Medicaid.
Put the mic close.
We have a one-payer system right now, but unfortunately Medicaid is politicized every year. Okay, so I looked it up that there's 1.2 million doctors in Western Europe, 200 million population. America has 330 million population, and we have 1 million doctors.
That's what I was saying.
General and
That's what I said.
yeah, so obviously we have 50% less doctors, more or less, than in Western Europe.
Right. Thanks to the AMA. They
Yeah,
have
another
not
corrupt.
allowed, AMA has to pass judgment on new medical schools. Okay, and there have not been any significant number of medical schools in the last 100 years, maybe 80 years. That's the problem.
They've been saying that all along. Supply and demand, it's economics.
The AMA is supporting 6- and 7-figure incomes for its members. That's what it's about in America.
All right, we got one more question right here.
Okay, so Medicaid, as I understand it, from having worked with people and helped them get on it, is for poor people.
Well,
You have to be low income to get
That's right. It's
Medicaid.
means tested. That's
And
right.
Medicare is for old people or maybe people who've been disabled for more than 3 years.
Correct.
And then we have ACA, which is a supplemental. And that's right, our current government is that
Trump took it.
Trump
did
taking
it.
away.
That's
So,
That was the closest thing to perfection. that
That's
we've come
right.
Close to,
right.
was the ACA.
What was it?
Affordable Care Act was a
Obamacare.
subsidy for private health insurance.
People had great coverage for a little money And the Trump administration.
Based on
killed
your
it.
income.
It was Obama's creation. And it's all gone.
I
It's
love
gone.
Obama.
There is no ACA.
We're gonna close out with this question.
Sorry?
Can't afford it. It's there. A lot of people can't afford it.
I'm about to give you the mic, 1 second.
That's America.
Just gonna let everybody know that this is gonna be the last question of the night, then we're gonna get into rebuttal.
Yeah, we're gonna have a good hour for rebuttals, so we got plenty of time for everybody to speak.
Is this microphone
It's on.
working? Okay, I'm wondering, if the Democrats win in November, do you think there's a chance that there could be a reversal of this horrible, big ugly bill provision that people on Medicaid have to work 20 hours a week if they're considered quote able-bodied? And that's gonna kick huge numbers of people off of Medicaid. People will lose their job. Like if somebody loses their job, gets laid off, they lose their Medicaid, you know? Things like that.
I don't think that the,
Or they
I don't think
get
the
it.
by-election.
What?
I don't think it's called a by-election in the fall,
Mhm.
is going to deal with federal issues, okay, like Medicaid or Medicare or anything else. It's just a bunch of congressmen whose terms are up because they redo terms every, 3 times every 2 years. So I don't think that the main issues that you're talking about are going to be discussed in the next election.
Because people are gonna die without that.
Well, I'm not
without
arguing
the-
about that. I agree with you. People are dying every day now. You're right, but this is a by-election. It's not a there are no federal issues on the ballot, okay? It's only congressmen trying to save their
They could
seats.
vote
Yeah,
against.
yes, of course, they can vote against.
Democratic.
Things are tough. This is a very difficult time for this country.
Yes, it is.
People are just beginning, this is a personal opinion, to see it in their pocketbooks, in their neighbors' pocketbooks, in the news. It's not good. Okay, I'm sorry, I'm going.
No, take it.
I want to get rid of this microphone.
All right.
People are tired of listening to me.
Right?
All right, all
Okay,
right, well, thank you once again, Michael, I appreciate,
It's a controversial subject.
right, and, don't go anywhere because we do have closing arguments coming from you. This is back
and
from you. All right,
we're
so
looking forward to hearing.
we're gonna move on to, rebuttals. Tim and I have discussed it, and we're gonna, each person, 5 minutes to give their rebuttals. So that being said, how many rebuttals do we have here in the room? And Tim, if you could check to see how many we have online.
Right now, we got
Three.
none online, but I know Charlie and Jake and probably a few more.
Looks like we got 5.
Raise your hand or put your,
We got
put
2,
your,
3, 4, 5.
put your icon up. I
I'm
know
gonna,
Charlie and then I know Sam
we got 6 in the room and we got Sam
and
and
Charlie,
Charlie, okay?
probably Jake too as well, I'm sure. He'll
All right, so we're gonna do, limit them to 5 minutes apiece. That being said, who's our first? Do we want to go online first, Tim?
Actually, why don't you let me go first because I've got a little bit to say about this. Give me about 5 minutes and we'll,
You're getting only 5 minutes.
and that's all I'm gonna say. I'll keep 5 minutes.
I got a timer here.
No, that's
Okay,
good.
where's the timer, man?
Get this out of the way.
Because unlike what I do in my Toastmasters stuff, where I'm specifically timed with speeches, I gotta get my own discipline back in again. All right, as far as healthcare is concerned, it often amazes me at how fast we'll spend money on defense, on bombs, on ways to kill people. Right now, Ukraine is becoming rich because of drone technology, because of the applied things. If you go back to Truman and the military industrial complex speech that he did, he was basically prescient when he had certain arguments about how much a weapon system would cost and how much that would be if we built a new carrier. It would be a certain number of schools lost, it'd be a certain number of benefits lost, and it'd be a certain number of other things lost. And the military, we're really good at breaking countries down, at invading, at getting things taken care of. But you got to remember, even at the end of World War II, we had something called the Marshall Plan. We had something that called the GI Bill. And believe it or not, there was a lot of benefits that accrued to a lot of soldiers and a lot of, frankly, white people that came out of the World War II that had our country prosperous. Yes, we did have a 90% tax rate at one time. But what I think is really needed now is what I've learned from a group called the Patriotic Millionaires. And they are some progressive millionaires who believe, hey, let's get some things fairly done right. Tax all money the same. Capital gains, wages, stock market income. Don't put a cap on the Medicare or the wages you get in. You pay a certain percentage of your taxes and it progresses up a little bit more because they can afford it. I mean, I'm not saying that, it's all the end all, and none of us likes paying taxes. But if we don't have it at the federal government, it's usually done in property taxes at the local level. It's usually done through state and federal governments. It really surprises me. For the last 12 years or so, our state budget has been balanced with a Democrat in office, and he's giving us some things that can do it. But yet at the same time, we elected this clown in office, and he has literally ran our country into the ground. I mean, Trump, he came in promising the world. He's a flim-flam man. P.T. Barnum at his best, at his worst. What we're going to, basically what we need to do to reform healthcare, it's eventually going to be some form of single-payer system, I believe. Because there's a lot of profit to be made with the insurance companies, but at the same time, we do need it. And the model we have right now is something called the police and fire departments, which are usually the biggest parts of budgets of almost any city around. And they don't screw around when it comes to police or fire. Perhaps maybe it's time to get healthcare on the same way. Algonquin at one point, being a rural town in the late 70s, didn't have ambulance service. We started with a volunteer corps, and eventually it did come in to paid paramedics over time as we grew. And our country is at a point now, especially with the older generation. It's not my contention that we can't afford it. It is my contention that maybe we ought to spend less on defense and more on healthcare, more on our infrastructure bills, and more on our basic human needs. My grandfather said it really good. He said, during the Depression, they were paying artists, but he said there was always a worry about the cost. But when the war came, watch out, because all the money broke out like a dam and they were able to do everything. Maybe it's our own human nature. I just don't know. But I'm saying we are the richest country in the world. We should be able to afford health care and give a good modicum of a successful, maybe Canadian, maybe France, like maybe something else. And yes, there'll be a role for the private insurance market because rich people will not want to wait, but they can pay for it then. Anyway, I've said enough. Thank you very much for listening to me tonight. And let's dump Trump in the midterms.
Okay, thank you for your rebuttal. Do we want to mic or do we?
Who wants to go next?
Tell us how you really feel.
You've heard how I feel. All right, Sam, you want to go next?
Yeah, we'll get Sam online. I'll give you hand signals to let you know how much time you have.
Okay, Sam, unmute. You're next.
Sure, I'll go next. I don't think I need 5 minutes. I just want to just state out. I mean, you kind of agree. Healthcare is an expense, and it is expensive. In the United States, I'm sure there's a lot of ways that we could reduce that expense. There's different. It's just a complex puzzle, first of all. But the bottom line is it has to be paid for one way or the other. And it is the individual that winds up paying for it, whether it's through taxes or an individual program, if you have to pay for your own policies. I think with the universal plan, more people would be able to get coverage and then the cost is spread around. So, I mean, I'm for universal coverage of some sort. Medicare is kind of like the basic plan, and it's obviously not perfect, but just get it fixed, and you know, work on fixing what's there and work with it. I am totally against the Advantage plans, which I participated in for a while because like with the speaker, I was drawn in to like the individual lower cost for me. But when I realized how much the government is actually paying for those plans, I realized that we all of us taxpayers are paying much more for that than we are for Medicare. And I also wanted to point out that some physicians do not accept the Advantage plans. Some hospital systems don't. For instance, Mayo has refused to accept any of those Advantage plans. That's just side information. Anyways, that's all I have.
Okay,
Thank you for your rebuttal, Sam. Okay, looks like we are done online.
Charlie, you want to
Currently, I know
go
Charlie-
next?
Charlie, you want to go next?
All right, Charlie, unmute.
Yeah, I'll go ahead. All right. First of all, I'd like to thank Mike for giving us an overview of a vital aspect of everyone's lives, in particular one that confronts us as we get older. I have three things I'll cover very tersely and briefly. Number one, the solution is very simple and has been around for many years. The employer, if you are employed by somebody, your employer should be obligated to provide for your health care, extending through retirement. If you are vested in a position, let's say 5 or 10 years, my employer pays for 75% of my health insurance. And the other 25% I can select from plans available, either ones very expensive, that I pay for those, or very cheap ones. So there's a selection once a year among the plans. If you want a lot of coverage, it's up to the individual. So there is an element of choice. You're not stuck with one plan. So the solution is right there. Number two, I disagree with you, Mike. The single most feared voting population in the United States, outside of the gun owners, are the senior citizens. And we can dictate what the issues are. The voters are not yet engaged in this campaign. And yes, I've known for years. I've been in campaigns. You want to make your issue. Every campaign has different issues. You want them to have the candidates make them discussing your issues. And we've done that for years with public transit. And the third thing I would like to talk about is, by the way, the unions are the best thing because we used to have to do this. We used to have to review the plans so the unions don't have junk insurance or pretend insurance. We had staff on board review the plans that were available for members of the union. That's what I mean. Another reason they're having a union is right there. But my last issue, number three, you've got to be cautious about relying on anecdotal information. Well, my cousin in Topeka had a headache and they have this health care there. For every example, there's a counterexample, and you never arrive at the truth. So you've got to look at the system in aggregate in that regard. So be cautious that your sample is like one or two people where you talk to somebody and you base your healthcare plan assessment on that basis. That's really not valid, and you people are much too intelligent to accept that. Anyhow, thanks again, Mike. Please come again with an update. And I think we can make it the issue in this election and every election.
Bring that mic
Thank
over.
you.
All right. And a good time was had by all.
All right, next we're gonna go with Jake online.
Jake, unmute, go ahead. Jake? Jake, you're up next.
Jake, go ahead. You're online.
Okay. Hi. Okay. I'm here. Okay. Hi. Thank you for your talk. Yeah, I'm in agreement. I don't think I have problems with the what do they call them? Medicare Advantage plans. I'm currently covered under the I'm currently covered under a Humana dual eligible plan, it's called. And as a result, I had two doctors who I had been seeing for years who dropped me because they're simply not in the network. It's an HMO type of network, and they're not covered by that plan. So they dropped me. So I was forced to look for alternative. I'm now as a result, I'm now seeing someone at Oak Street Health on Devon Avenue in Chicago, Devon and Greenview in Chicago. By the way, I was told that Oak Street Health is now owned by they're now owned by CVS, same company that owns CVS. So there are a lot of corporate mergers going on there in the healthcare field. What else can I say? Yeah, I can see a problem. I can see a problem that Canada has because they have a lid on the amount of money that a doctor can earn. And consequently, I'm told that there are a lot of Canadian doctors who spend only 6 months out of the year in Canada, enough to meet their quota. And then during the winter months, they fly down to Florida where they can make a lot more money. So consequently, there's a lot of doctor shortage in Canada. Also, I am in agreement. We have too many lawyers and too few doctors. We have more lawyers in this country than any other country in the world. People are constantly suing each other. That's why I asked questions about the issue of liability. Also, I'm entirely in agreement with what Tim said earlier, that we spend too much money on the military. I do not blame the Ukrainians for fighting the Russians the way they have been. The Russians deserve it. They deserve to be. I mean, the Ukrainians deserve to fight back, and at this point, it looks like they're on the brink of defeating the Russians. That's not my problem. My biggest problem with the military is how much money we spend on nuclear weapons. This president has taken us out of several major nuclear arms control agreements that have been on the books for decades, including the Comprehensive Nuclear Test Ban Treaty. And these treaties have been in place. They've been bipartisan in nature. It was Kennedy and Khrushchev who gave us the Underground Nuclear Weapons Testing Treaty in 1963, I believe. And then later on, it was expanded to a Comprehensive Nuclear Test Ban Treaty under, I think it was Bill Clinton. And there's been several. Nixon gave us 3 major nuclear arms control issues. The point is that these treaties have been allowed to expire, and Donald Trump has refused to reenact them or renegotiate them. And as a result, we're starting to do nuclear weapons testing again. You know how much nuclear weapons testing costs us? $1 billion per test.
Okay, Jake, we need to
test to decide whether or not we have the firepower available to blow ourselves to smithereens. That's what we're spending our money on. And
Okay,
it
Jake,
should
we
be
gotta wrap it up.
nuclear weapons should be it's time that nuclear weapons should be abolished, and that money would be much more better spent on real economic development, real job creation, healthcare, environmental protection, et cetera, and we'd all be much better off.
Okay.
All right, thank you, Jake. We're gonna go ahead and start working in the room here. We got a young lady behind the mic right now. She's gonna go ahead and dig into it.
Okay, so here I am. I paid into Medicare and all that stuff out of my paychecks for over 50 years. And now I'm paying a fortune every month for coverage with them, not seeing doctors or anything, just a premium every fucking month. That's huge. I mean, it's close to $5,000 a month. Is that ridiculous after I paid in for all those years? This is not the way I think our healthcare should be. After I paid in for 50 years and didn't get $1 of Medicare coverage for all those 50 years, because I was paying for my Blue Cross Blue Shield and stuff, and I have to pay for that to cover the other 20%, which is costing an arm and a leg too. Good thing I still have two of each left. Must have had 6 before.
What's your committee deal?
$5,000.
Okay, thank you for your rebuttal.
What's your plan?
Okay, our next rebuttal, Mike.
Primary.
What plan do we have?
I don't know.
Get your rebuttal, please.
Be $2,000 a month.
I have Blue Cross Blue Shield F2.
Well, you got extra stuff.
Yeah, well, because otherwise I have to pay a bunch of bills.
We still have a program to get through here. You guys can talk in the parking lot afterwards. Please go ahead with your rebuttal.
I believe one of your parting statements was, Mike, that it was a perfect system when there was Medicare, Medicaid, and ACA.
Portable care. Yeah. Yeah, portable, a lot better.
He's asking you a question.
I'm sorry.
You and Ian over. What's your rebuttal?
I believe your last statement was when it was Medicare, Medicaid, and ACA option, it was a perfect system. Did you say that or somebody else said, somebody said that?
Maybe it was better.
There's never been a perfect system and the ACA is gone.
No. If the ACA came back,
Maybe. We don't know. We don't know. It was a limited population that took the ACA and it's gone.
it can come back though, anything can change.
Either Trump. It's not
You
gonna
have
be
4 minutes remaining.
Well, he's not gonna live forever. Trump could be gone.
No,
tomorrow.
he's gonna live forever. Ask him.
Okay.
Republicans are always against it. The Republicans. are
Yeah, we have a very corrupt American government right now. So this is an economic problem, obviously. We always knew we didn't have enough doctors. Have you ever heard of supply and demand?
Miss.
Okay.
So
Sorry, I don't remember.
I looked at the numbers and there are 330 million people in America. And there's only 1.1 million doctors, MDs. And in Europe, I thought there was more than 200 million people in Western Europe. I thought it was around 300 million.
Depends on how many countries you count. I mean, Germany's the biggest country. France is next.
That's 150 million right there.
I'm gonna remind you, this is the time for rebuttal. This is not a back and forth. Please state your rebuttal.
So anyway, so Europe has
This is many doctors.
almost twice as many doctors, at least 1.5 times as many doctors. Technical problem. I'll just talk louder. So, yeah, so by keeping supply low, it makes them more valuable. So it's kind of it's a greed problem in this country. And probably a
AMA, it's the AMA.
Anyway, it seems to me that Medicare is fine. I think you're overpaying for some other services. Medicaid is for lower incomes. No question, but it has some nice benefits, but it's politicized with our corrupt government, with the corrupt Washington DC. So it goes back and forth and back and forth.
2 minutes remaining.
2 minutes? What would you say, Mike? Anyway, whenever private industry gets involved with things, prices go way up. They're in it for the profit. So I just do not trust. I mean, certain situations where there's good competition, but insurance companies are kind of like monopolies and they have monopolistic power. So prices will go up and you're going to get screwed and you're going to get ripped off. This is America, probably the most corrupt country in the world besides the shithole ones. So I just don't trust Wall Street. I don't trust American companies. And we just have to have a better government and better people in Washington, D.C. So go out and vote. We got to get rid of the Republicans right away. In fact, we probably should get rid of all 500 in Washington.
I'm so sorry.
It's the same problem. What? You don't like what I'm saying?
No. He's telling you to.
Okay, listen, I'm gonna be able to say what I want to say because people ramble on here. Okay, it's the same problem with government in England, in Europe. England has 2,000 people in their parliament. We have 500 corrupt freaks in Washington, D.C. So it's supply and demand. How many?
30
seconds?
30 seconds. Now you got 23.
I'll end right there.
Okay, who's next?
It's a corrupt country.
Yeah, you can do it from there.
Because money talks.
I just have a rhetorical question, which is like a rebuttal in that it doesn't need an answer, but what is with all of these robocalls from Medicare? It's like a very expensive endeavor of whoever it is that's calling, because we're gonna need legislation to get them to stop calling. And if it's Medicare, well, the people are gonna be tripping on drugs trying to get to the phone. And I just would like an answer about why this can't be stopped, because it's driving me crazy and my Advantage plan is going to have to pay for psychiatric help. So thank you.
Hey, who's next? Okay, go ahead.
I get a tremendous number of robocalls every day, and I hang up on them, and then I take. Hi, this is Amy. We have a special this week on auto insurance. I hang up on them and take the phone off the hook. Okay.
Sit right here, Tim.
I know, I got him.
Yeah, but one thing I like about living today is we're learning so much about health. We're learning that you have to eat well. We're learning that you have to exercise. We're learning that you have to stretch. We're learning what fascia is. We're learning so many things about just being healthy. And the other side of the coin is of being healthy is your Medicare. Your medical program is much more affordable and works better. The interesting thing about France being such a wonderful system is that the French people are really healthy people. They don't eat much. They have a glass of wine every day. You know, they're not very heavy. In Europe, chemicals are kept out of the foods, whereas here, chemicals are like put into the foods. And we have something called the Standard American Diet, which euphemistically is called the SAD diet, SAD, Standard American Diet. And during COVID, when people were dying of COVID, like half the thing was, it was related illnesses. And the related illnesses were just being overweight, being diabetic, not having enough exercise, being out of shape. And that's not what you got in France. In France, you have people who walk for a living instead of drive around. In France, you have people who take the bus. In France, you have people who eat a little breakfast, eat a little lunch, and eat a little dinner. Whereas here we have people who go to McDonald's and eat something called heavily processed foods. And these things are killing the people who eat them. And what I like about being alive today is this
the thought of save yourself. It's like if you can keep yourself out of the medical system by not being diabetic, by having a healthy, do it by walking, simple things like walking, like getting up and out of a chair 20 times a day, by doing simple things. If you can take care of yourself and keep yourself out of the health system, a couple of things will happen. One of them is you won't deal with the health system unless you get hit by a bus, all right, which is always a possibility. And the other one is you'll be living, you won't be costing the health system money for things that are avoidable. There's a giant, how much time do I have?
2 minutes, yeah.
There's a giant circle between the farmers who grow as much as they can and the manufacturers who are manufacturing as much addictive food as they can, and the restaurateurs, the fast food places that are feeding us as much addictive food as they can, and the medical profession that is treating us for eating the addictive food that comes out of the farms, and then for the pharmaceuticals that are selling us drugs to treat the addictive diseases that come out of the farms and out of the farm system we had. So try to save yourself, try to eat healthy, avoid heavily processed foods. There's an application called Yucca that you can get from your phone, Y-U-K-A. It's European, and it rates all the foods that you have through the barcode, and that it will tell you, one, if it's generally well made, and two, tell you about the additives in it that are either benign or unhealthy. So go load Yucca onto your phone, eat healthy, move, exercise, keep yourself out of the health system, and you'll drive health costs down. You'll drive the you'll drive the pharmaceuticals, like not out of business, but you'll lower the cost of pharmaceuticals. There'll be more doctor time because there'll be less people visiting. That's all I have to say.
Thank you for your rebuttal.
Do you want to talk?
Get the young lady here and then we'll get to you,
Yeah.
Arnie. Okay. I'll come get it.
Okay, hi, my name is Ellen. There's really so much to say about this subject. You can't cover it all, remotely in 5 minutes. I very, it's nice, your note to individual responsibility, but there's a larger system, and we're not going to get rid of sick people. People are going to get sick. They're gonna die, they're gonna get injured. I was just watching this doctor online, and he was saying that everybody should get this blood test called lipoprotein A. You only need to get it once in your life, and it predisposes you to early heart disease, basically. So you can't just necessarily eat the right food and you'll avoid the healthcare system. Yes, it's, eat the right food, exercise, but you could still have problems. Okay, so there's a larger societal issue. We have a broken system. I did miss the talk, so sorry, it took me a while to get here. But we pay more per capita than the European countries for healthcare, and our results are worse. We are doing something wrong, and there is an inconsistency of care. People are moving in and out of, they aren't able to get the health care that they need. They're in and out of health insurance. They can't necessarily afford it. I myself know somebody who waits until they get sick and then they go to the emergency room because people can't necessarily afford health insurance. I knew that when the Supreme Court got rid of the individual mandate for the Affordable Health Care Act, that meant that the people who were healthier and younger we're going to leave the marketplace. That means the sicker people were going to remain in the marketplace, and premiums were and costs and premiums were going to increase. And so that, that's a problem. You can't, you're fighting against the math. And then, they refuse, the Congress, and the president refused to extend, the increased subsidies for the ACA. So a lot of people can't afford it anymore. For the people who are poorer, who are considered, quote, able-bodied, they're going to be putting in a 20 hour, like an 80-hour a month work requirement. So if people are having trouble maintaining employment for any reason, some of those people can lose their Medicaid, and then they're not going to have health insurance. And then they've made it as hard as possible for people who don't get health insurance through their family or through a job to maintain health insurance, because the premiums are raised on the ACA, and they're going to be kicking a whole bunch of people off of Medicaid. So they're kind of screwing people either way. Then I just want to mention that there's also a lot of states that did not engage in Medicaid expansion. So a lot of individuals can't get Medicaid even though they're poor. And there's also a group of people that make too much money to be eligible for Medicaid, but they make too little money to afford the Affordable Care Act. They aren't eligible for the Affordable Care Act because they make too little money, and they are not eligible for Medicaid because they make too little money. And that's just despicable. I mean, this is just an extremely unethical system. It should be that you should be able to get health care based on your needs, not how much money you have. If you need therapy, you should be able to get therapy. If you need, whatever. I mean, within reason, we're not going to pay for plastic surgery, unnecessary plastic surgery and stuff. Do I have more time?
It's about 15 seconds.
15 seconds. Okay. There's a lot to say, but I'll take that for another time. Thank you.
Thank you for your rebuttal. Do we have any more here in the room?
Yeah, come on up.
Ernie will get you top.
You meant you're making too much for Medicaid.
Yeah, they're too much for ACA.
Start your time, too. I know you'd like to rant. I'm joking.
Much for
Ah.
Medicaid, too little to get into.
Nice to see you in person, Ernie.
What?
Nice to see you in person.
Yeah, occasionally that happens. Okay, anyway, I enjoyed the presentation and the discussion after here. I am disappointed that we didn't hear more specifics on how it's done in other places, what successes they're having with it. There was a little bit of that, but I was hoping for more. Maybe I'll have to look at that book or do some research on my own. And I get back to the point, 20%, we spent 17 to 20% of our GDP on healthcare. No other country in the world is that high. I think, at my understanding, Britain's around 12, and other countries are way less than that. And I'm wondering why this is. Some people think doctors are paid too much. Some probably are when they turn their practices into corporations and run it more like some kind of a retail business. But a lot of doctors.
Speak up, please. I can't hear you.
What?
Speak up, Jake. Speak up. Jake can't hear you.
Oh, can everybody else hear me? All right, Jake, I think you're gonna have to take the wax out of your ears. I'm sorry. Anyway, as far as the quality of our care, this is a few years ago, the World Health Organization rated us like 34th in the world, just ahead of Cuba. Okay, so I think, I don't know, this has to do with time with doctors or what it is, but we are not doing that well. And newer doctors are, if anything, underpaid. You have to realize that doctors don't start making money until they're 32. If you don't go to college, you start making money when you're 18. If you go to college, 22, doctors wait another 10 years. And so because of that, they make high incomes fairly from the start, but not necessarily enough to make up for that in some cases. Now, young doctors have a different attitude. A consultant that I heard speak at a medical economics convention said there's a great difference. She talks to young and older doctors. There's a great deal of difference. The younger doctors are still, most of them are in medicine because they want to help patients. Now, the older doctors really want to run a big business. And so there's a difference there. Somehow I get more people with the attitudes of the young doctors, more people going to medical school who want to just simply take care of patients. One last note, we've been talking about single payer here, which everybody seems hot on that. And I'm a part of a system which is true socialized. That's not socialized medicine, single payer. That's single payer, and somebody pays the doctors who are private doctors. The VA, where I go, the doctors are employees of the VA system. They are federal employees, paid by the government. I've had many good years with VA. Now, there have been some problems lately because Trump is threatening to cut 75% of the VA medical budget. He hasn't yet, but he's done some things, and it is noticeable. But that is true socialized medicine. I go to the doctor when I have a problem. They see me, they take care of me. I had cataract surgery and various other things. Never got a bill. The only bill I get is a very small bill, a copay for pharmaceuticals. So if you want an easy system, that is the best way to go. I'm not saying that's the best way to go overall, but it's a good way to simplify things. Okay, thank you very much.
Hey, do we have any more rebuttals here in the room?
They're just signing things.
Any more rebuttals?
All right, I guess I'll get the last one.
They just signed it.
Okay, thank you everyone for the rebuttals, very thought provoking, and I certainly do appreciate it. I move this so that Jake can hear me online. So my rebuttal is it's against single payer healthcare. Healthcare is beneficial primarily to the person receiving the care and a burden on those paying for it. Let's face it, people generally care more about their health when there's an ailment. When they're feeling fine, it's not a thought in their mind. So this is exponentially egregious when we have a government body to manage the fund. So essentially, single payer healthcare, what we're talking about here is removing all the insurance companies and letting the government be the insurance company.
Okay.
That is not okay. That is nowhere near okay. Government is irresponsible with our day-to-day money, much less to sit there and take care of our healthcare is egregious on top of itself. Having the government manage the funds rises the overall cost. As one benevolent public service needs to be fairly compensated for their collecting and spending the money accordingly. So in other words, you're still paying an insurance company. It's just the people you elect or the people, the cronies of the people you elect. If you remove government from the equation, we make healthcare competitive and prices will fall drastically. While we are at it, we need to revitalize the healthcare system to where they have to be upfront in their pricing. You don't take your car to the mechanic and he says, yeah, well, we'll send you a bill when we're done with the work we think it needs. If they're more upfront with their pricing, you could see whether or not it's, you need to shop around, maybe see a different doctor. Comparatively, you'll spend $5,000 for heart surgery and the next guy will say $50,000. They need to be upfront with their pricing rather than hit you with a bill when you're trying to cure yourself from the ailments and the shock of the surgery. When we have a government that being the primary payer of our medicine, there is no due diligence on making certain the government is negotiating the best interest of the payer or the receiver. And that is my rebuttal on the single payer insurance, single payer, healthcare situation. Okay, with that, we have no more rebuttals. And I thank everybody. Our speaker has left for the evening, so there's not going to be any closing arguments from him. That being said, we got a mic right there, Mike.
Okay.
Plug it on.
All I'm gonna say tonight is thank you for everybody for a nice, orderly, very well done college of complexes. And Chris, go ahead and adjourn us.
Okay, without any further ado, we will go ahead and adjourn meeting number 3,863. Just a quick reminder before we go, there will be no meeting on July 4th, which would be 2 weeks from today. But on July 18th, we do have another interesting conversation to be had, whether or not we are really truly free. Robert,
Who's speaking in 2 weeks?
That's 4 weeks, Jake.
That's 4 weeks from
And he's
today.
explaining it right
Oh,
now.
okay.
It's gonna be Robert Lichtenberg.
Oh, okay.
Professor Robert Lichtenberg will be here to talk about whether or not we are truly free.
4 weeks.
And that is going to be in 4 weeks. July 18th is the date. I'm looking forward to hearing that conversation and of course, hearing all the questions and answers and the rebuttals. Without further ado, we call 3,863 meeting of the College of Complexes adjourned.